Hey there, it's Dr. Justin Marchegiani. Today's topic is going to be on Hashimoto's, low thyroid function, and the depression, anxiety, mood connection. Let's dig in. A lot of people have thyroid issues and they may have mood issues along with it. They may have anxiety. They may have heart palpitations. They may not be able to sleep, or they just constantly feel in this tired, wiry state. This is important. We have to get to the root cause of it. So today we're going to dig in and look at the underlying physiological and biochemical causes of why this could be. So there's actually research out showing a correlation between a lot of these mood conditions and Hashimoto's. Now, why could that be from a physiological, biochemical standpoint? Number one, we know that a lot of autoimmune issues, gluten and gastrointestinal permeability or leaky gut is connected, meaning there's permeability in the gut lining, undigested food particles are coming in. Those foods are inflammatory. They're opening up those tight junctions. They're creating immune responses. They're creating inflammatory responses. They're allowing things like lipopolysaccharides from bacteria to come through, which are activating our microglial cells in the brain. There's a molecular mimicry thing happening where certain surface proteins of foods like casein and like gluten are going to rev up the immune system to go and attack the thyroid gland. And this is important. When the thyroid gland gets attacked, it gets stabbed. These little follicles hold about 3 to 4 months of thyroid hormone at a time. So you poke it, you stab it, you throw a knife at it, a nunchuck at it, a Chinese star, little bits of thyroid hormone start to spit out. And that thyroid hormone can increase the metabolism in a short term. So that increase can cause jumpiness. It can cause anxiety. It can cause palpitations. Also, underlying nutrient imbalances can also exacerbate thyroid function. We need healthy bits of magnesium. That's important for relaxing. We need amino acids like dopamine, which are important for relaxing. Amino acids that help with GABA and our inhibitory neurotransmitters are helpful. Selenium is also really important. These calm down the immune system. So if we have gut issues and we're going to have malabsorption with these important nutrients that help sedate and relax the immune system and also help the thyroid to work better. Also, gut infections increase gut permeability. When we have when we have a leaky gut, that's going to go and create stress in the brain, right? Dr. Perlmutter's talked about this in his book, The Brain Maker. There's lots of other people out there talking about this gut-brain axis, the gut-brain connection. It happens through inflammation, right? Foods, infections. It happens through nutrient deficiencies, whether it's a poor diet or just your gut's so distressed you're not absorbing those foods correctly. It can also happen with low stomach acid and enzyme levels where we can't break down the important nutrients we need to build our hormones up. And then also the gut permeability followed by the foods and the infection can rev up the immune system. And it can also cause gut permeability in the gut, which then also affects the brain as well. And we're seeing a lot of research showing this connection between Hashimoto's, anxiety, and depression. Really important. A lot of the new medications for depression that are actually coming out are working on inflammation in the brain because they know inflammation is an important root cause to why people are having these mood issues. And we know inflammation in the brain, inflammation in the thyroid, especially most thyroid issues are Hashimoto's. That means it's an autoimmune condition where the immune system is beating up that thyroid gland. So if we can calm down the immune system, it's going to be better. I mean, the reason why I'm leery about any drug that controls inflammation, just go back to the mid 2000s when we had the cyclooxygenase inhibitor drugs, the COX-2, for instance, Vioxx kills 60 or 70,000 people taken the correct way. So I'm very leery of a lot of the mechanisms in which big pharma uses their medications because they tend to block other important pathways that could be really helpful. Like the COX pathways are really important for regenerating the gut lining in the heart. So yeah, you block those pathways on one side, you reduce inflammation, but then you put liver stress and gut stress and cardiovascular stress on the other side. So I'm very leery of robbing Peter to pay Paul, so to speak. All right, so today we're going to open it up for a live Q&A, try to keep it on the topic of Hashimoto's and thyroid. Again, I'm one of the only docs that tries to do a lot of these live Q&As clinically based. So this information is for educational uses anyway. Make sure you have a good functional medicine doc that you're working with. If you want to dive in with myself or my colleagues, click below, and I look forward to helping y'all. All right, let's bring up some questions and see where we are at. So off the bat, Akbar writes in about the lower dose that he's on for his clearing herbs for the infection. So Akbar, every week, once you have your standard low dose, every week, once you've been at that dose, you try to raise it up again. Try to raise it up again. So if you're at 1 capsule, for instance, on the para 1, right? And that's all you can tolerate. Hold it stable for a week. And then after 1 week, raise it up again to 2 and just try to incrementally do it. And I wouldn't be on the herbs longer than 2 to 3 months. So make sure you have a consult with me so we can chat and talk about that. But 2 to 3 months, and continue with the ginger tea and or any binding compounds in between. Airtight writes in, is that related to fecal odor? Unconsciously, old socks, body odor. I was diagnosed with small intestinal as well. Not sure what that means. Not sure what that means. What are the top 2 to 3 lab tests do you recommend for gut issues? Definitely a high quality gut test. If there's a lot more gut issues, then I'd recommend potentially a SIBO test along with it. But my favorite 2 to 3 are going to be a GI map test, a organic acid test, and a SIBO panel. And you can go to justinhealth.com/shop, hit the lab test section, and we can order those for you as well. Lisa writes in, what are the single supplements for healing leaky gut? Depends. A lot of people look at healing gut as like putting aloe on your sunburn, right? Well, the root cause of the sunburn is just not being out in the sun too long, or not wearing a protectant, or not wearing a shirt. The aloe isn't necessarily the root cause. The difference is a lot of people that give a lot of these gut healing nutrients, they still aren't addressing the root cause, meaning they may still have a poor diet. They may still have hypochlorhydria. They may still have other infections. They may still have other nutrient deficiencies. And, the healing gut support is not going to be enough to fix the root issue. Now, it's okay. You can add it in there. In my line, we use something called GI Restore that has the L-glutamine, the aloe, the DGL, the healing, soothing nutrients. We'll also incorporate a lot of the ginger tea that's in the members area for my patients as well. And that's very helpful as kind of that third R, the third R being the repairing the gut lining and repairing the hormone phase. Is Dulse good for thyroid? So Dulse is going to be higher in iodine, so you got to be careful with that, because if you have a raging, autoimmune issue, or your Hashimoto's antibodies are high, depending on how much you consume, you could potentially rev it up. So you really want to work with a good functional medicine doc if you're going to be recommending iodine based on the thyroid condition. Can I do keto having Hashimoto's? I think it's fine to do keto having Hashimoto's. Most people that have thyroid issues, there tends to be this connection with insulin resistance and low thyroid function. And we know a ketogenic diet can actually help decrease insulin resistance, meaning you need less insulin to help glucose get into your cell, and partly because you're restricting a lot of that carbohydrate. So I think it can help. For people that are of normal weight, normal waist size, etc., then it may be negative. So it just depends. Excellent here. Let's see here. Do you think lack of iodine plays a role in thyroid nodules? It can. The major 2 causes of iodine nodules are going to be Hashimoto's. And then we know that that can be caused by gluten, by infections, and that we know certain things like low iodine, especially in the Rust Belt, right, in that goiter belt area, the soils are very low in iodine. So it's possible, right? It's possible low iodine could be part of the nodule issue, but so could Hashimoto's as well. K Gupta writes in, is a GI test the same as a comprehensive stool test? It just depends. There's different companies that market things differently. So I like BioHealth has a 401H stool test that I still use. Doctors Data has a comprehensive 3-day stool test. It's okay. It's not my main go-to though. And then there's the GSL, the GI map one that I like that's genetic. There's the DRG. They changed their name recently. They're another genetic test. And then we also look at some of the bacteria and fungal metabolites that we'll see in the urine via an organic acid test too. Anthony writes in, hey, Anthony, I've been taking ProBioFlora, Megaspore, and GI Restore, and it has calmed my stomach, and digestion significantly has improved. Awesome, Anthony. Keep it up. Very good. Good feedback. I'm glad that you're back on track. I know some of that dairy was setting you off, so keep it up. Martin writes in, leaky gut, I believe it's glutamine, glycine, chondroitin sulfate, bone broth. The paleo diet will go a long way to helping the microbiome and also convert fiber to butyrate. Yep, very, very true, Martin. Can Hashimoto's be reversed? Yes, it can. I'm just very careful when I say be reversed. What we can do is we can dampen the epigenetic expression of it. So essentially it's no longer presenting. Now, what does that mean? Some people I've seen their antibodies clinically go down from, hundreds of times above the limit back down to normal. I had one patient yesterday, 2 days ago, her antibodies were over 2,000 and she's back down to 25-30. So, I mean, that's a huge reduction. Most endocrinologists, they've never seen that before. So they would probably think that she was misdiagnosed or was a spontaneous remission kind of thing. I see it very frequently. Some may go from like 1,500 to 500. right? We want to get it at least below 500. We see typically a 60 or 70% reduction typically. And I've seen some where they just go from like sky high to almost under the radar. And for LabCorp requests, that's typically, you know, less than 34 on the TPO side, less than 8 to 1 on the thyroid globulin side. Airtight writes in, well, I was diagnosed with small intestinal TB. Not sure what that means. Small intestinal tuberculosis. Probably, I doubt that. I've noticed fecal body odor, foul hives, avoid gluten right now. However, in taking ashwagandha supplements, I also have asthma and dry skin. Okay, I need a question there. I'm not sure what the question is. Martin writes in, yes, I know someone who did with a vegan diet. I recommend paleo. Good feedback. Can you FaceTime with a patient if they don't have Skype? Yep, I can FaceTime. I have my iPhone going here for Facebook. And we also have Zoom as well and Skype. Tons of options. Booger writes in, I have a toenail problem. Yeah, well, number one, if you have a fungal issue, you want to look at the gut first. But number two, sometimes we treat the gut and it's not enough. We have to topically hit the toenail just because, you know, that tissue doesn't have a great blood supply, right? You don't feel, you know, there's not like blood vessels going through it. So it kind of gets this osmosis of immune cells and support. So sometimes you have to topically hit that with some soaks and or some topical essential oils like melaleuca or oil of oregano. If you go to my site, I have a nail herbal fungus soak that works very well. And we combine that with a antifungal salve or oil of oregano as well. All right, cool. Any other questions, y'all? Let me know. If not, oh, check out my lunch. Oh, my wife made this for me here. So I got a nice little salad here with some avocados. I got some nice little mini pickles here and some cut up chicken with Mark's Primal Mayo. So I got a really good protein, fat-based lunch here. Got my little bands over in the corner. I was just doing some sets, some deadlifts, and some curls with my X3 bar. So that's a new little toy that I'm experimenting with. Supposedly increases growth hormone 300%. So I'll be experimenting and getting back to you on that. Maybe have to bring Dr. Joe Quish on the podcast to do an interview on that. All right, y'all. You have a phenomenal day. Any last questions? Oh, hold on. A couple more. Cassandra writes in, or Cassie writes in, Hashimoto's gluten, dairy, free 15 years, chronic anxiety, now in AIP, trying to lower carbs, but never satiated unless uncomfortably full, history of binge eating. Okay, so number one, we have to make sure that you're able to digest and break these foods down. That's number one. So I'm always looking at enzymes and HCl. How does your stool look? Is your stool floating? Is your stool sinking? We got to look at the gut. Is there an infection? But I would look at using cooking methods like an Instapot to pre-digest these foods more and make it easier on your guts. And we may even want to add in an elemental or some pre-digested aminos to make it easier on your gut. In your experience, does someone with rosacea usually have a gut infection? A lot of the research is now showing that rosacea is connected to an autoimmune condition. I had rosacea when I was younger, and I will tell you an autoimmune paleo template made it go away. So that is phenomenal. Good to know. Doctor, I eat too many of my toenails. Well, I don't know how you're that flexible to get to your toenails, but be careful. Chewing on your nails too much is associated with pinworms, so you got to be careful there. Anthony writes back, what do you think about nootropics? I plan on watching your podcast you did with Evan. So great question. So off the bat, there's some simple things like the baseline nootropics are going to be B vitamins. I know it sounds simple. I went to a nootropic seminar that Steve Folks hosted at Bulletproof a couple years back. He's like, guys, the most underrated nootropic is just B vitamins. Second, I love amino acids, dopamine, tyrosine, L-dopa. I think this really helps with focus. After that, you can kind of get into the modafinil, Provigil, aniracetam, piracetam kind of area. I like piracetam. It's water soluble. Aniracetam is fat soluble, sticks around a little faster. 400 to 800 milligrams of piracetam, I think, is reasonable. And give it a try. You do too much, it can have the opposite effect. And also, I like PQQ too. I feel like that really helps the mitochondria and helps me focus too. Egg yolks is a nootropic. Well, I mean, egg yolks are loaded with choline, and choline is really good for brain function. So I wouldn't disagree with you on that for sure. Awesome. All right, guys, great chatting with y'all. Hope you have a phenomenal day. Give me a thumbs up. Give me a subscribe. I'll be back tomorrow morning at 9 a.m. CST Standard Time. I'm trying to get a routine going. I just try to do these things randomly in between patients because my schedule's so tight. But tomorrow at 9 a.m., I'm going to be there. I look forward to connecting with y'all tomorrow. You guys take care. Bye now.